Everybody, I'm Dr. Ejiro Isiorho from Corrective Step Foot Health Center in Tigard, Oregon. We have a patient who has an ingrown toenail. Yeah, look at that. Unfortunately, he's been dealing with this for a while, and that's where you can see some of the chronic swelling and even some of that blood that's coming on the inside. And if you look to the other side, we actually took this nail off 3 months ago or so. So it was a temporary nail removal. So you can see the new nail growing in right there. And this is the final portion of the nail that's removed. So basically the nail's going to grow from the root all the way out to the tip. And I was just telling my patient that in order to make this nail nice and smooth and remove some of this weird debris and just this shape, urea cream, 40% is what we're going to recommend. Applying it to the nail once a day. And that's going to smooth that nail and it's going to make everything nice and easy. And we'll talk about that after the clinic. After the visit. But right now we're going to do my favorite procedure, an ingrown toenail. And our patient's already told us that they're numb. Are you still numb?
I think so. I believe so.
Okay. Yes. We'll find out in a minute or so. But fortunately for you, we've done this procedure on this patient before, and the nail comes off relatively quick and easy. So using our gauze to give him a little pad, using our rubber band as a temporary tourniquet, and then using our hemostats to basically create and hold tension on our tourniquet. And tilt your foot down just a hair. And now that we're in good position, I like to use one instrument if possible, a hemostat. There's a smooth side and a rough side. I always do the smooth side towards the patient's skin. So I'm going to loosen up the nail fold on the top, and then I'm going to go underneath the nail bed and loosen that portion up as well too. So patient, I'm going to lean your head back a little bit so you can just have a little relaxation. Okay. So loosening it up and just walk it back and forth, and that's done. I'll do the same thing for the other side. Like I said, I know this patient's now pretty well, and I know that it's pretty loose already. So that's loose. So patient, take 3, 2, 1. So now we're going to loosen that bottom portion up. And our patient is doing a great job. And now this is my favorite part where I get to drop my hand and see everything come out. Ooh, that nail's really thin. He's got a big nail. So now it seems like we're going to have to piecemeal this a little bit since it doesn't want to come off all at one. But of course, as I say that, there he goes. So there's it now. So part of the issue with the last patient's nail is that there were some dystrophic or mycotic changes to it. So this near portion right here is good and healthy, and you can see with this jagged line where the nail basically split. And it split right in that area that's a little bit diseased or weakened. And that's what the fungus or just nail changes, dystrophic or weird changes can do to the toenail. It can make it weaken and basically not maintain its integrity. And that's why the nail actually has a little bit more of a fungus component underneath it as well too. And again, you can see the healthy portion, you can see the disease portion, and you can see where that nail cracked as well too. So long story short, take care of your toenails, otherwise you're going to be seeing me. So our patient was feeling a little tender, which does happen sometimes if especially there's an infection. So we're going to go right to the source and give him some medication. You may even see some of this local anesthetic coming back in. I like to use a simple 1-to-1 mixture of 1% lidocaine plain and 0.5% bupivacaine plain. And so since our patient's already numb for the most part, I'm just going to give it right to the tender area. Are you doing okay, patient?
Yes.
Okay. Okay, so now that that's done, we are ready to dress your foot and your toe, okay? So for dressings, I like to use Neosporin, Polysporin, bacitracin, or even petroleum jelly, on an antibiotic or non-adherent gauze or Vaseline impregnated gauze. And some 2x2 gauze. And we make a little bit of a, I call it a bozo toe. So we're going to leave this dressing on for 24 hours. After 24 hours, you're going to soak it off. After you soak it off, you want to clean it with antibacterial soap and water.
Okay.
Pat dry it. You don't want to rub it, otherwise it's going to hurt.
Okay.
After you get done pat drying it, you want to use some antibiotic ointments, Neosporin, Polysporin, bacitracin, or even petroleum jelly or Vaseline. You soak it twice a day. A shower counts as a soak, and then you can just soak it. Lukewarm Epsom salt, and then clean it, and then use a couple antibiotic ointments. On day 5, you do not need to use antibiotic ointment. On day 5, you do not need to soak it twice a day. On day 5, you do not have to wear a Band-Aid overnight. We'll see you back in 2 weeks. We'll call you tomorrow in case anything changes, and you have our on-call number. Do you have any questions at all?
Just one soaking after day 5, on day 5.
Yep, just once a day after day 5.
Got it.
Okay.
Okay, thank you.
All right, take care.